Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this story episode, we are basically going to be talking about the theme of this year, and that is CEUs.
At first I was like, what are you talking about? But it is a reporting year.
Yes, and we know it's November, so it's probably getting a little dicey on the CEU time.
You know what, I gotta say, more people than I've ever heard before have finished their CEUs early this year.
Hey, that's awesome.
Mm-hmm. I feel like I keep hearing that. Like, I keep hearing it.
Hey, I mean, it beats having to be stressed down to the wire like, oh, I gotta get these last CEUs.
Especially over the holidays.
Oh, I know. When you would rather be doing nothing.
Do nothing.
Do nothing.
Well, I guess that also makes that the theme of every other year then.
Yeah, literally every other year. That's so true. Yeah. So we do have a recurring theme on this show, if you haven't noticed.
So anyway, we are talking about CEUs, courses, all things continuing education. And to kick it off, I did share some Instagram story questions to prompt us. And honestly, I wasn't surprised by the answers.
Okay.
I didn't really ask very polarizing questions this time. First one was, have you ever been to an athletic training conference? And honestly, I think more than anything, I was surprised by this answer because only 79% of people said yes.
Ooh, interesting.
Which I don't know why. I kind of just assumed that it would be 100%.
At least for sure as a student.
Right, that's what I was
Because I feel like if you're in a program, you're not forced to go, but if you're kind of strongly recommended.
Encouraged.
Yes, strongly.
The networking.
Yes. And I mean, I get it from a working professional. It's really hard depending on when the conferences are. I mean, NATA is usually pretty solid in the summer, but a lot of district ones tend to happen within the athletic year. So sometimes that's it's kind of hard to get out to do that.
Which I was also thinking about because I was like, maybe it's because people go to more courses, which actually I also asked, have you ever taken a course outside of a conference?
Yeah.
Which, I mean, you usually get way more hands-on and way more applicable knowledge more than just the theory of stuff, which is kind of why we started this podcast, because we didn't really, I mean, we appreciate conferences and we appreciate continuing education and stuff, but the real applicable knowledge that you can take, and obviously we can't really be hands-on that much with a podcast, but you know, the stuff that you can actually take and change your practice.
And also make it digestible.
Exactly. So the answer to this was 86% of people said that they have taken a course, which is higher than the 79 who have been to a conference.
Yeah, for
which
sure.
I am very happy with that. That's pretty cool.
Yeah. Well, like you said, it a lot of times they're hands-on, right? You're diving into something a little bit deeper, whereas at a conference, it's a lecture that kind of gets you started on the idea.
And then you get to delve into which courses you're going to take from that, you know?
Exactly.
Which also the courses are more expensive usually.
Yes.
And they're more time consuming.
Yeah. Yeah, I'd say so.
I mean, I guess it does depend. If you're going NAT, it's 3 or 4 days.
Yeah.
Or sometimes conferences are or courses could be 8 hours, or they could be a whole weekend.
Which would be about the same as NATA.
And if you haven't taken a course, we are sharing some courses that other people have taken.
Ooh,
and
sweet.
That we've taken.
Yes, we have taken.
Actually,
some pretty
no
cool
one
ones.
shared anything that we have. The two main ones I'm thinking of that we were going to talk about.
Really?
No, yeah, no.
Ooh, I'm intrigued. Now I'm excited.
Let's get started with a course. This one is actually a collegiate course, a continuing education collegiate course about wound care.
Ooh, okay. I'm excited for this one. This one's by Natasha N. I took the wound management course from Rocky Mountain University this summer, which made me rethink how we clean wounds. The method of sweeping/wiping the debris out of the wound from center to the edges isn't the best option. It can actually just spread around the bacteria. The best method is to irrigate the wound. Doesn't even have to be with saline. Clean water works just as effectively. I've stopped using iodine swabs on open wounds too, because they can actually do more damage than good by killing and destroying the new granulated tissues that have started to form. Plus, they seem to put even my toughest athletes in pain. So I figured, what's the point of putting them through a 10-second painful sting if it doesn't even help?
Right.
The course is 4 weeks long, but you work on the assignments and listen to the lectures at your own pace throughout the week. The course is mostly focused on suturing and learning basic suture skills. Since sutures are a form of wound closure, there is heavy discussion on general wound care and infection prevention. I found it when I Googled suture courses for athletic trainers. I wanted to add it to my skill set to keep up with new MSAT grads. Plus, at the time, I worked ice hockey at a place where we didn't have a team doctor at the games, so I thought it'd be beneficial to have the skill if need be. Another bonus of the course is its evidence-based education, and it counts as CEUs. That's really cool.
I didn't even think about courses like at a college.
Yeah, that's true.
I feel like when you think of like courses, you think of like blood flow restriction or mulligan.
Like some like third party kind of concept.
Mm-hmm.
Yeah, that's kind of cool. That's really neat.
Also, I feel like the wound management, like, you know, when you're searching courses, you think like manual therapy or like stuff like that. I think that wound management is something we do every day.
Literally, it is definitely one of the things that commonly happens throughout the day.
Right. And I feel like we talk about it in school, but
I think we barely talked about it.
Yeah, exactly. Like, I feel like
everyone does their own thing.
Right.
Which is why we did do an episode on the position statement.
We did.
For that one.
We did. And what was it? 2 to 4 PPS of saline spray?
Yes. That was the takeaway for you?
The takeaway that I got.
Was the amount of pressure for the saline spray?
Yep. I still remember that.
That's good.
Actually, I hope I remember that. What if that's the wrong number?
No, I think that's right. It sounds familiar to me.
Yeah, but I think wound management is like something that like we wouldn't normally like think
of.
Right.
Yeah.
Right. And it's so applicable. But also if you think about when you go to conferences,
mm-hmm.
When was the last time you went to a lecture about wound management other than suture? I mean, yes, suturing.
Yeah, I would say probably just suturing, which by the way, I haven't even been able to go to the suturing sessions at these conferences.
I thought you just did suturing.
But it wasn't at a conference. It was at our preceptor meeting.
Okay.
Which I mean, technically is a CEU course, but
mm-hmm.
Until then, because they've been having these sessions at conferences for a while now,
mm-hmm.
and every time it just never works into my schedule.
Yeah. See,
that is the one thing with like conferences and stuff is like, especially like with NATA, there's so many like cool things happening at one time.
Mm-hmm.
You're like, if only this could have been the next session.
That was overwhelming for me the first time that I went to NATA. Like, I feel like when you you start with like a district.
Yeah.
Or like even your state conference, like there's like one lecture at a time or like 2 lectures that you have to pick between 2 options. Yeah. What is
Not
it?
At NATA.
What am I thinking of? Like the theory of choice? No, I don't know what it's called.
Like that choice
dilemma of
paradox thing.
Paradox of choice. Is that what it's called?
Sure. I can't remember the exact phrasing. I'm sure
something about how more choices are overwhelming, and it makes you happier to have fewer choices. Actually,
you're paralyzed with too many choices.
Yeah. Is that what it is? The paralysis of choice? The paradox of choice?
Someone knows this who's listening. I promise. Someone's got
it's killing them in their car. They're like, no, it's
screaming
not that. It's not that.
Screaming at the podcast.
We got another one about suturing that kind of really felt to me how I felt. What's up?
I wanted to explore this overwhelming feeling about NATA because NATA, there's a lot. For sure. But if you've been to an ACSM conference, that's like NATA on like steroids. Like the programming guide is like a Medco catalog. Like this thing is thick. Yeah. So when you said like overwhelming, it made me think of that. I was like, yeah, man, ACSM had a lot going on. So it just only keeps getting more and more chaotic. Busy? A lot more things.
Options?
More options. Definitely more options.
More choose your own adventure?
Yeah. Yes, definitely. It is definitely a role-playing game.
So anyway, back to the sutures. So Courtney G, she said that one of her favorite courses ever was sutures, the suturing course. Okay. And I was talking to her and I was like, hey, like for real, like, do you think that you could integrate this into your practice?
Yeah.
Because that's one of the things that I feel like we have talked about with other athletic trainers and just in general. And she said no for 3 main reasons. 1, it's billable, so the hospital would want to make the quick cash. 2, I'm not allowed to do a numbing injection. And 3, we don't always work in the most sterile environments. But it was still a fun and challenging course to take.
See, that, to point number 2, that's my thing is like it's cool that we're like knowing how to do this, but I feel like in the field, like, unless you've been given the okay by your physician to do that injection, it's like, I mean, I can't really do, like,
right.
I'm not going to do this to shove a needle into someone who's already tender to make them more tender.
Well, I mean, we're not allowed to do that anyway.
Yeah. Well, the suturing, right? It's a needle that goes through, right? So,
we should talk to Dr. Kreisworth because he does suturing for jiu-jitsu. Or I don't know if he actually. I know I've seen some posts from him.
Yeah, we should. That's a good point. Yeah,
and he's been talking more about sutures lately. And he does a lot of like rock tape stuff too, which we took a rock tape course from him.
Fantastic.
Yeah.
It was fantastic.
It really was.
I think one of the most interesting things was, it was just like, again, it was like the actual rock tape deal. And the disclaimer at the beginning was, hey, you're going to test a lot of this stuff on yourselves. Like, hey, if you get, you might get nauseous, so like, hey, if you don't feel comfortable doing it, putting certain like tapes on you, like you don't have to. And Sandra and I were sitting there like nauseous? Are we for like what? Like, how did someone get nauseous? I felt it at the end of the day. Us. Yeah.
Yeah.
Yeah, I felt it at the end of the day.
I think just all the signaling
it was such a stimulus having because like you put the tape on you, well, you're just gonna leave it on.
Right.
Right. You're not gonna like take it off each time. So next thing you know, you have like almost half your body covered in rock tape.
Right.
It is a lot for your body to process.
Right. Honestly, I think that it would be beneficial to take again in terms of like, we took that course. Were you a student? No, you were certified.
No, I was.
I don't think I knew you when you were a student.
No, you did not. You've only known me certified.
That's true. So we took it when. Oh, how long? You must have been certified for like a year or 2.
Yeah, I think just a year.
And then, and I was a student, so I think it would be really cool to take it again with certified eyes, at least for me, or at least more experienced eyes for you.
Yeah.
Because, like, I feel like now I'm more obviously like down a little bit further in my career, but I think now I understand things a different way and I understand my clinical approach. Like, you think like, your clinical philosophy when you're like first certified, but like.
It's always changing though. It's always being, no, I don't want to say change. It's always being shaped.
Yes. I think now that I'm more shaped.
Yeah.
I think it'd be cool to like revisit that because I still use a lot of those techniques.
Yeah.
Not that I like use rock tape or kinesio tape like that often, especially in football season. I don't really use it too much, but like as far as like baseball, softball, or like more like chronic injuries that I'm trying to get like more rehabilitation, like cueing and like some of the stimulus from the tape, like I'll do that a lot more. Another one that people really like is dry needling.
Ooh, I've heard a lot of good things.
So Gustavo C said, I use IAR dry needling all the time. I wouldn't say that it changed much about my practice because I'm still very hands-on, but it has given me another tool that I can use. I feel that I'm able to do more in the sense that it is able to get to parts that I can't get to or hard areas to work on. Also, I am able to take different approaches in terms of rehab and recovery. I will never needle an athlete who is unwilling or frightful of it, but I will always suggest it. Some take better to it than others. It is also a nice one to have as I can stick an athlete and then work on another athlete at the same time while the needles are in. I like the IAR model as it talks and discusses the 3 major ideologies and models that most other courses only cover one type.
Oh, that's interesting.
Allowing me to have a better understanding and different technique than the other courses.
Nice.
That was another thing that like when I was talking to someone about taking BFR, like you kind of have to figure out which, and it's hard because if you don't really know much about BFR, it's like, well, how do I pick a course?
Yeah.
But like certain certain certifications are for like different machines, or like they teach you on their machine, and if that machine is not affordable to you, like how applicable, like the basic knowledge is applicable, but like are you going to be able to apply it to something that you're actually going to use? So like sometimes when you're choosing a course, you should probably talk to someone who's done it, or someone who like is a little bit more knowledgeable in the topic that can kind of give you more insight than, you know, than just, this is the closest one to me.
No, for sure.
That fits 100%. In my schedule. Click.
Just need the CEUs.
Yeah. So we did a mulligan course, and honestly, like,
holy smokes,
the best ever.
It's awesome.
I'm surprised that no one else has mentioned this at all, especially because it is
awesome.
So like you could use it probably for most injuries.
Yeah.
And the thing is,
literally,
the reason why it's so applicable is because like we learn in school, like you treat musculoskeletal, and you know, you hear the muscles, and here's like how to do this. But what if they get a joint injury, ankle joint? What if they get a knee joint injury? What if like finger, even like what am I trying to, sprained fingers?
Yeah.
I want to say jammed fingers.
Which is a sprain. I blow my kids' minds every time I tell them that. I just jam my finger. Yeah, it's a sprain. Those are the same. I'm like, those are the same. Your finger literally isn't going in on itself. It's bending a certain way. You just don't feel that part.
Yes. It's the weakest link.
Yes.
Sprained fingers. Why can I not remember this right now?
It's Monday morning.
Apparently. For sprained fingers, you could use mulligan, and it's because mulligan.
Well, that's how it started.
Right.
That's how he figured it out.
Right. So mulligan is about treating the joints. And I think that's what's like so integral is I feel like we've seen mulligan, or even like joint mobilizations. It's just a different way to do joint mobilizations.
Yes.
And honestly, sometimes it's the same as some things you've been doing, but like to get the whole realm of it.
Yeah. I think the one thing that I think that kind of separates mulligan, what makes it such a great tool to have in the toolkit is
it's pain free.
I was just gonna say is basically the philosophy that it's built on is, one, it has to be pain free. So like when you do the mobilization, it has to take the pain away. And then two, that it should be long lasting, right? So it shouldn't just kind of be like, it should actually last a little bit longer, having that pain relief. So I think all those elements, you get a lot of buy-in from clinicians and patients because they feel like, oh my goodness, that was magic. You made me feel better, right? So it is really a cool concept. Like it makes you look like a genius.
Well, there's also the hands-on aspect of it,
which patients are going to love that too,
right? And not only if you're like, oh, but I don't have time to do that. There are some like self-mobilizations.
I was just about to say, right? Yeah, it's a hands-on thing, but I know like a lot of people get concerned, like, oh man, I can't really. There are self-mobilizations too, so you can teach them how to do the mob on themselves too. Like it's pretty cool.
So we've only taken one official course of the lower extremity.
Yes.
But there's like a lower extremity, there's an upper extremity, and there's a spine.
Advanced. That's basically just kind of go into some.
Oh, because like the lower and lower spine, upper and upper spine, right? And then advanced.
Yes.
So that's like something that we're gonna be looking into to complete that. But it's also something that ahead of us, like our preceptors or our mentors and some other clinicians who are working alongside used a lot.
Mm-hmm.
And so even like knowing someone or seeing the applicability of it like really helped in that.
Oh, 100%.
Also, even if we weren't like sold on this already, I was sold, and I know I've told this on the podcast before, I was sold when we took the course.
Oh, yeah.
And the practitioner who was teaching the course literally like fixed my hip internal rotation.
Well, first of all, you scared the hell out of him because I think he thought you dislocated your hip.
Yeah. So I used to have like on my right side, like a severe lack of internal rotation and hip flexion. And I had a bunch of people like through school and through my early career, like try to work on it and try to like get different opinions and kind of like also like learn from them and try to figure out like, okay, like what do we do with hips? And
what do we do?
And then literally I I was just the volunteer for the mulligan technique of the hips, and literally with one treatment that was like 30 seconds, I got a huge clunk in my hip, and then I was able to
the instructor's scared.
I was like, boom.
It was a loud thud.
Yeah. Like, just treat the joint, and then we were able to keep that with like rehab. But just the different technique that he did, that he was able to actually treat the joint itself.
Mm-hmm.
And you could see, like, he had me do internal rotation of my hips, and like my right leg was like severely limited compared to my left side.
Yeah.
And then I was able to, it just really made my hip feel free.
Yeah.
So really cool. Look into it. Too long didn't.
Apparently, we are the unofficial
really cool.
spokespeople for Mulligan.
No,
it was a cool course.
Yeah.
Yeah, I'm excited for our next one.
Here's another one from another manual therapy.
Oh, perfect.
You want to read this one?
Yes, this one's by Christa H. So I did the PRT course during the Doctorate of Athletic Training. The DAT as a whole, because Idaho is manual therapy centered, taught me the true global and holistic approach to care. PRT being a piece of that puzzle. PRT aims to be a more global approach, teaching you to, quote-unquote, map the necessary soft tissue that needs to be treated. For example, there is something Spacer calls the wheelhouse protocol that aims to treat SI joint dysfunction. You start with ultrasound to prep the SI joint for the manual intervention. Then treat about 8 to 10 structures that attach to the sacrum and pelvis with PRT. Then potentially use muscle energy technique if needed in joint mobilizations. Another example, if a patient is having anterior shoulder pain not caused by tissue injury, I will find all the tender points in not just the biceps, but the pecs, rotator cuff muscles, scalenes, SCM, upper trap, levator, etc., and treat everything that could affect the shoulder girdle. You must have a good handle on anatomy for this course, or it will certainly enhance your knowledge from pure necessity. It is a nervous system-based intervention, so it gave me a better idea of soft tissue and nervous system interaction, which is important. That's awesome.
Mm-hmm.
If done correctly, PRT has immediate results, which is a game changer for college athletes, which is my population. It does take time, which some may see as a perceived barrier to using it. I do my best to carve out the necessary time with patients to perform it, which takes planning, but it works every time. I never regret shuffling things around to use it. I want to also make a note that my approach to manual therapy with my patients is never standalone. Manual therapy is always a piece of the treatment puzzle, often beginning with a modality to prep the tissue for manual intervention I'm going to use, and then whatever rehabilitation is appropriate, which I think is important.
Right. I think that's one of the biggest things that I think of when I think of courses is manual therapy.
Yeah, for sure. Because again, very hands-on. There's different techniques, different methods of doing things for sure.
That is one cool thing. Like, some of the DAT programs have like that hands-on component with like certain manual therapy, or you can kind of like look and see like, oh, what does this program have, and can I take a course like outside of that? Because then also, if you're looking for a course, you can kind of look and see what certain programs offer, and then you can look for courses near you. Yeah,
for sure. And then I'm assuming this is I believe PRT, that's the positional release technique, I believe.
Mm-hmm.
I've heard cool things about it.
Mm-hmm.
I have heard cool things.
When I think of positional release, I also think of strain counter strain, which is another.
I was gonna say I believe it's the like same idea, but I think the way it's taught, I think, could be two different things.
Well, we got one about that too.
Yeah. Oh, look, see, it's like I was ready.
You want to read this one?
Yes, this one's by Anonymous. The strain counter strain course really expanded my manual therapy abilities, and we even nicknamed the techniques Magic Fingers. I even did Magic Fingers just now. I think it was a 2 to 3 day course. The premise is that muscle dysfunction exists at the muscle fiber level, actin and myosin, So strain counter strain has the clinician find the dysfunction by scanning specific points on the body, looking for tissue that feels like a dry sponge versus a wet sponge. Ooh, that's an interesting concept.
Mm-hmm.
And placing the patient in a position that shortens the muscle fiber, allowing it to return to a functional, relaxed state. Once the clinician's fingers finds the dysfunction, there is no manual pressure applied. It is just holding the spot for feedback. That is the best way to describe it, but it's been a while, so there's probably a better definition. You hold that position for 90 seconds.
Which kind of reminds me of like trigger points.
Yeah. Yeah, for sure.
And also the, I don't know about dry sponge, wet sponge, but what I use is like the, you know when you like pucker your hand to make like a palm butt? Like a butt crack with your palm?
Yeah.
Like you feel the thenar eminence.
Yes.
And it's like firm, and then you let go, and it's not firm. Like that's what I use for.
I don't think I can make much of a palm butt.
Oh.
I don't have that kind of.
Did you know that as you age, you lose fat mostly from your hands first? I don't know if that's true, but that's what I learned. Maybe you should fact check.
Where has this episode gone? We're talking about palm butts, losing fat in your hands.
Yeah, I'm pretty sure you lose fat in your hands. That was what one of my professors used to say all the time. I never fact checked him, but I just use that as my.
Holy smokes!
I don't know why. Like that just came,
that resonated.
Yeah,
and 2 to 4 psi on the saline.
Mm-hmm. We're full of
fun facts,
tidbits today.
Yeah.
We actually I asked, speaking of like kind of things that stuck out, that was a perfect.
Look at that
segue.
I didn't read ahead, guys. I'm telling you, this is just natural.
This is down. This is down. So, I did ask about if there was anything that stuck out to you from like a conference or a CEU thing. Audric W said 2 things. One thing is the exercise is a test and the test is an exercise.
I feel like I've heard this.
And the other one is the patient is the smartest person in the room.
I feel like I've heard that too.
So for the first one, he said the exercise of the test is going to tell you everything about their movement quality, where their range of motion is in each joint, and where the restrictions might be, and how to regress or progress the movement pattern. So I've actually taken to this, like when I'm prescribing rehab, I don't write like a number, but like 8 to 12 reps is supposed to be like strength based. Yeah. And then like a higher number is supposed to be like endurance. So usually what I'll do is...
You don't default to 3 sets of 10?
I used to. And I do like start with that number. But what I do is like I'll have them do the first set. And I say like... And if it's a harder exercise, I'll be like, let's start with 8. Yeah. And I watch their movement. And then like if it's easier, I'll be like, let's do 15. And then I'll watch them.
I'll take it down to 6.
I haven't done 6 because I haven't really done like anything that's usually they can get to 8. If they're not, then I'm doing something else.
Yeah.
So anyway, I'll have them do that and then I'll watch them and then I'll be like, okay, do you think you can do like, I'll watch them get to like whatever, like 12 or something. I'll be like, can you keep going? Yes. Okay. When you get fatigued, stop. We get that number, get an idea. If it's like high, then we're making that harder.
Yeah.
If it's if I watch them and then I do they do like 1 set, I'll be like, okay, do another set. If you feel good, get a 3rd set in. If you don't, we'll switch to the next one.
Yeah.
So I kind of leave the ball in their court because, but also like I watched them the first time and then I kind of like try to move on.
Yeah, there have been times I tell them 3 sets of 10 and then I watch them do it. I'm like,
never mind.
Let's do 8. Let's do 8.
I also really like the patient is the smartest person in the room. He says, they are the only person who knows their history, what they eat, how they got hurt, how much pain they're in, when it hurts, when it doesn't hurt, when they feel a muscle contracting or not. We might know the body, but we don't know theirs.
Man, the exercise is a test, and the test is an exercise. I feel like I know this one. I feel like this is like an SFMA
you guys
thing.
Went to the same course.
Maybe. Hey, you know what? Maybe. But I don't. I feel like that's an SFMA thing. I have yet to take that. I want to.
I don't know.
It's really expensive though.
I'm okay.
Yes, you are.
No, I mean, like, I like it. That one doesn't intrigue me as much as like.
I heard it's intense.
All of the others.
I have the book. I'm ready.
You are ready.
I've yet to. I need to read that book.
Can you give us what is SFMA?
So it's basically by the same group that made FMS. Mm-hmm. SFMA is the Selective Functional Movement Assessment, and essentially it's supposed to piggyback off the off the FMS. So the idea is, if someone found dysfunction to the FMS, they hand off to a clinician. Well, that clinician would then use the evaluation process from the SFMA to dive into deeper why they have that dysfunction. So it's pretty in depth, and I use some of the concepts because I've had some colleagues take it, and like they've kind of given me some insight on it, and I've enjoyed the concepts behind it. That group has like a textbook out that just talks about movement in general, and like I have it, super stoked, want to read it, but my biomechanics professor when I was a student was like the man has a PhD, this man's a genius, and he's like, man, I had to read, like I had to sit down and like take it in. I'm like, oh my god. So
see, I just think I think it's great for some people, but I think in my setting, like I think it's a little bit too in-depth, time-consuming for my needs.
Fair. Well, there's a lot of like how it was broken down. There's a lot of like different flow charts too. So there's a lot of different concepts. Like I have heard it's a pretty intense course.
Exactly. So all for you. So
I'll share it with you.
Thank you. Thank you. So something that we also, we went to the Sports Medicine Update Memorial Hermann.
Yes, we did.
With Sports Medicine Broadcast. He invited us there, and one of the things that stuck out for me there is you can rehab people, show exercises and stretches, but if we don't address the biomechanics and posture to the best of our ability, we haven't fully addressed the problem.
Yes, it's true.
And that kind of reminded me when I heard Audric, so I was like, this kind of reminded me. And then another thing that we talked about, because we haven't really talked about like the on-demand CEUs, which are so prevalent, and obviously like we provide some.
Yeah.
Sarah Y says her favorite CEU course was, or just in general, like Adrian Lowe. He discusses pain on MedRidge.
Oh, I haven't seen that like actual one, but I've seen like it on there, and I'm like, oh, that one looks good.
Yeah, she says, I love all of his courses and has changed my approach to pain management in my athletes. A lot of it is telling my athletes that their pain is valid and helping them understand why they're in pain. After that, we'll try different pain management techniques, desensitization, meditation, etc., to help decrease pain and increase rehab outcomes.
Nice.
Which I feel like that's another thing too, is like it seems theoretical, but I feel like it's more applicable than we give it credit.
Yeah, for sure. I mean, at the end of the day, everyone we deal with is in pain.
Yes. Yeah.
Yeah.
I was trying to think of like something not, but
right. At some point, everything revolves around
dysfunction.
Pain. Are they in pain yet?
Well, I'm just trying to think of like, let's say like, just saying like.
Okay, yeah, let's do this.
For example, like my elbow dislocation, where the kid wasn't in pain at all.
Fair.
Obviously, he needs us.
Yeah, that's true. 90%.
Yeah.
90% of
the body's amazing because that should cause you a lot of pain.
Well, no, you see, the body's doing its job, and like, oh, this is going to be a painful stimulus. Here's some endogenous opioids.
Right.
Let's get you out of this situation alive.
Right.
Yeah. I was gonna say something about pain too. Oh, I always like giving my students, because we had. Again, my biomechanics professor was just a genius. He gave us this one article to read, and it was like about how we move in pain and how it affects the motor system. So I love giving that one to all the athletic training students to be like, hey, this is why like we need to really focus on how we do rehab, because one, when you're in pain or injury, right, these are the compensations that happen, but also like don't discredit that like the modalities that help with like pain, because if they're moving in pain, there's a problem, right? So it helps kind of expand their way of thinking.
Yeah. Changing course a little bit for
course.
This is another course.
Okay.
But instead of manual therapy, it's emergencies.
Ooh, interesting.
Yeah, so Justin C said in 2 minutes or less. It's through sports medicine concepts. I think it is called something different now, which I did look into this because I was pretty interested in it. It's called Core 4. I believe. If that's the same thing, I'm pretty sure it's called Core 4. He said, it's my favorite because of the content and how interactive it is. The time I did it on ice, they took an actual incident that happened in hockey games and mimicked it the best they could. So if they were head first in the boards or a goalie in the net, they were in the net or on the boards. It was great to practice some of the most stressful situations an athletic trainer can be in rather than just talk about it. So this is, I feel like it bases off of like the EAP practice that we do, except that they actually put you in a real life like situation that's happened and like don't rely on what you know, like we're going to practice this.
Yeah.
So that when it does happen, you actually, and it's like Core 4 because it's like cervical spine injury, head trauma, truncal trauma, and then cardiac arrest or arrhythmia. So there's like the head, the heart.
Yeah. The Core 4.
Exactly. The Core 4. So I thought that was pretty cool.
Yeah.
Especially for people I think that aren't as comfortable with like emergencies.
Yeah. No, for sure.
And this is our annual plug of work on your weaknesses, not as much your strengths.
Yeah.
Obviously, continue to work on your strengths, but it's hard.
It's hard. Yeah, it's hard because you want to do the stuff you're good at.
You want to do the stuff that you like.
Yeah.
That actually also reminds me of we got one on mental health first aid.
Oh, that's cool.
Someone said, I think NATA offers one through their CEUs, and there are other resources online that are free. It's helpful for knowing how to ask questions and how to refer, especially for athletes that are considering taking their life.
Yeah,
and that's something that I feel like is hard unless you have been there.
Yeah.
So I think talking about it more is helpful.
Big time.
And figuring out what other people do. Also, I forgot to give speaking of plugs, I forgot to give our plug that if you guys are interested in MedBridge, we do have a code. Use code ATCorner for $150 off. You can get a subscription. It's good for a year. And it is access to on-demand CEUs, just like Sarah Y said, like she really likes the pain from Adrian Lowe, but they have like different courses on all different topics.
And they're all really good. I was just saying, I've seen a few of the MedBridge ones, and they're pretty good.
Yeah, and I know some people do like throughout their like it's through their school or like whatever. You could just get it on your own, but we do have that code. You don't need to go to a special website, but it is down in the show notes.
Yep.
And then we do have another CPR one.
Oh, nice. This one's by Stephanie B.
And this one I asked her. This one was specifically reacting about like, have you ever changed your practice because of course?
Yeah.
And she was talking about CPR with equipment on during equipment removal.
Oh, okay. Southwest Illinois Athletic Training Conference does an awesome lecture and even better labs. Can't get higher quality CEUs for a better price. Anyone in the St. Louis area is missing out big time if they don't come. Happens every summer. Honestly, it's worth flying in for if you're not a local. We hosted in Belleville, Illinois, typically Belleville East High School of the Belleville Township's The Cave. It's every year in July.
Which I feel like is pretty accessible.
Yeah, which is a good time for most ATs, I'd say.
June or July.
Hosted by the Southwest Illinois Athletic Training Conference. This past year's theme was emergency. We had 3 doctors speak, one for shoulder and elbow dislocations in the field, another for tibial femoral dislocations. She had performed the relocation on the field at Belleville West High School the year before.
Oh, nice.
That's crazy.
Oh, wow. Tibial femoral. I just realized, like...
Yeah.
Wow.
Yeah.
True knee.
1 on acute traumatic internal injuries. We had 2 Illinois ATs speak on the updated IHSA heat policy. They helped write it. For labs, we had a shoulder model we dislocated and relocated. So much fun, which I'm sure that'd be really cool, actually. Lower body splinting with various types of splints to make sure we engaged all budgets and resources. time equipment removal, spine boarding, CPR during equipment removal, cold water immersion with 3 different techniques, and a rectal thermometer model to practice draping and inserting a rectal thermometer. It was $60 altogether. Oh my goodness. That's a great price.
Affordable.
7 CEUs. That's
and breakfast
that's
and lunch
less
provided.
than $10 per CEU.
And lunch and breakfast provided.
I know, I haven't gotten there yet.
No, I'm
still amazed by the first 2.
Hey, we like CEUs, but we like food too.
And yes, breakfast and lunch provided, again, for $60.
Yeah.
That's a great deal.
Mm-hmm. It really is.
That's
and
a great deal.
This is why, like,
I think we need to go.
We love just different aspects of different continuing education, right? So, like, there's things you can get out of conferences. There are things you can get out of courses. There are things you get out of, like on demand.
Yeah.
But the labs and the hands-on, there's nothing like that. And when we went to the Memorial Hermann Sports Medicine Update, I think the way that they did it was really cool because they had the topics that were like 3 topics in the morning, let's say, and then they would do 3 of those labs. Yeah. So like they would do like lecture A, lecture B, lecture C, and then they would do lab A, lab B, lab C.
Oh yeah.
So and everyone participated and everyone was able to do like all of it. So you had the lecture based and you had the lab based, but like everything had its like correlating.
Yeah, and I thought it was nice too, like you didn't miss out.
No.
Everyone got to do each lab. So it's not like, oh, like, again, how some conferences are, like, they're same time slots. Well, you have to pick one or the other. No, everyone got to do these ones.
But it was really cool because it was a smaller group for the labs because they did 3 labs at a time, but then they repeated that 3 times.
Yeah.
So then it just made a lot of sense. Whoever planned that, kudos to them. It was really awesome.
2 thumbs up.
4 thumbs up. So if you could find like a conference, if you're going to go to a conference, definitely try to find the labs that are hands-on. Obviously, not everyone has them. Yeah. But if you're available to do that, the hands-on is, in our opinion, better.
Yeah, for sure.
And then, we only have 2 more. 2 more things.
Time flies when you're having fun.
So one thing that I also was surprised that only one person talked about, Sarah G said, a conference that I would love to repeat is the Andrews Institute Football Conference. Ooh. I did it in person. It was years ago, but I believe they still have it. It's called Injuries in Football. They had not only general presentations, but great case studies from SEC schools.
Oh, nice. That's
cool. I think the thing that I really liked about this is it's a central topic about one sport, and that's what you're learning about. And I think when you're looking for like a conference, like, it's really cool to have like your conference that goes over like concussion and evaluation and mental health and manual therapy all like in the same day. But when you have something that's so specific to one area and you can really go a little bit more in depth on that. Yeah. Like if you work baseball, for example, like find a baseball conference, like they have them.
Yeah. They do have them.
And I think that that's what's really cool. And I think people don't realize that, like, when they're looking for things, they're like, oh, NATA or my district or my state. Like, those are cool. Those are great. We're not telling you not to go to them. We go to them. But also, like, look and see what works best for you, not just, this is what I do every year.
Yeah, that's true. Add to the tool belt.
Right.
Add to the tool belt.
Right. And then our last listener story is from Haley L. She said, I went to a pediatric sports medicine conference and learned different approaches to surgery with open growth plates. Aha moments.
Oh, that's awesome.
And so I talked to her because this is something I also wanted to save for last, because I feel like we've also kind of been riding the theme of like, what can you learn from just theory? Just like labs are important, hands-on is important, but like, why would we go to a talk on surgery? Yeah. So she said, understanding the surgical process helps to understand the post-surgical signs and symptoms and recovery process. I try to visualize the internal structures within therapeutic exercises. Yeah. Which I think is so true. And there are some things that you can't do hands-on on. Like, sure, it would be great to go observe surgery, but that's like something to talk to your team doc about, right? Yeah. Like not at a conference. Can't get
hands-on that surgery?
Not really. But like things like that. I think it's more. I think that we don't put a lot of emphasis on that. Like when you do go to something that's not hands-on, like how are you going to take that into your practice?
Yeah, for sure.
How are you going to take this podcast into your practice? Because we're not.
That's the big question.
Hands-on, most of the time.
Yeah, I mean it'd be
cool.
It'd be cool if our just hands came out of the podcast,
right?
Or creepy, one of the two.
Willy Wonka status.
Oompa, oompa.
Another one that we didn't talk about was NKT.
Yes.
Neurokinetic therapy.
I got the book.
You do. What book do you not have?
That's fair. We do have a lot of books. I don't know if you've noticed at this point yet, but I'm pretty nerdy.
Really?
Yeah, I know. You could be surprised.
NKT is another one that is hands-on. It's manual therapy.
It is.
Right?
Yeah, it's manual therapy.
It's like soft tissue based.
It's an idea
like musculoskeletal based.
It's an idea of how to formulate your manual therapy, because it's not necessarily teaching you a specific technique, because how they break it down is you're basically just
like looking at like antagonists and agonists and synergists
and then it just
that's another knowing the body one.
Yeah, exactly.
Yeah.
Yeah. So they're not teaching you like necessarily like a specific, here's how you do a technique. It's here's how you go about your evaluation to determine how you're going to do it.
It's a different approach.
Yes.
And I think that's...
I've seen it, like, I haven't taken the course. Like I said, I've gone through the book and I've talked to a lot of people, so I'm trying to, like, integrate some of it into my practice, because it is a lot, like, because it is a full body deal. But, like, for some difficult things in, like the spine and stuff like that, I've seen it make at least a pretty good difference on how I treat someone. Based on like what muscles are being activated, like overactive and stuff like that.
I think also it's hard to figure out what you don't know.
Yeah.
Like I feel like, not NKT specifically, but like in general when you're trying to find a course, because like, for example, let's say I was looking into like muscle energy techniques, because I learned a bunch of single muscle energy techniques from clinicians like 4 years ago, and really cool stuff. Yeah. But I stopped using them and I don't remember them, and I'm trying to figure out where I can go to get that knowledge back.
Yeah.
So things like that, that's like, okay, well, if you don't have the name of a course, or if you don't have like an idea, like how do you figure out?
How do you find it?
Exactly. So talking to people, hopefully some of these are new ones, or we're going to put up in our Facebook group some other courses, or like a question that you guys can write your favorite courses and stuff. That way people can kind of like get a better idea of what other people have done. And just also remember that what you're doing doesn't necessarily have to be for CEUs as well, because like, for example, when I was in performing arts, I did my Pilates certification. So I have a foundation of Pilates, and like it's really, really helped my exercise cueing.
Yeah.
But that's like something that maybe if I was in the traditional setting, I mean, I am in the traditional setting now, but like
at the time,
I don't know that I necessarily would have done it.
Yeah.
I do still use it now, but it's also because I have some equipment available to me.
Yeah.
And like it did help with a ton of cueing. However, the certification process did take a long time, because you have to do 500 hours, 500 practice hours after you already do the course, which my course was like a accelerated course that's like, oh no, not accelerated. It's a intensive course where I was like there all the time.
I remember dropping you off.
Yeah. I was like there all day, every day.
Carpool.
But like some people just do it like every weekend, or like, for example, so like some things it's like, okay, well, how much are you going to use it in your setting?
Yeah.
Or like the CSCS, the performance exercise, the corrective exercise.
I got those, which have been nice. They do help. I really like the PES because it was, or the performance enhancement specialist one, because like it really helps with like your late stage rehab. Mm-hmm. Right? That's why I was kind of looking at the strength conditioning credential, because oh man, that'd be great for like that late stage rehab. But like I feel like that credential is like, you know, it is very intense, and like I feel like I'm not doing that credential much of a service if I'm not like doing more strength and conditioning stuff. So I felt like as an athletic trainer, the PES was like right up my alley, what I needed.
Right. Well, that's another thing is like I was looking into some rehab, other like rehab certifications and courses and stuff. Mm-hmm. And there was one that was like super expensive, and I ended up talking to someone who had done it, and he was like, honestly, not worth the money.
Interesting.
And I was like, thank you.
Yeah.
So, you know, honestly, like
save me money.
Yeah, exactly. Like before you do something, maybe talk to someone who have done it.
One that I do want to do, like I've been wanting to do this for years, is the McKenzie
I was gonna
spine ones.
Yeah.
Like I've heard great things. There was a PT that we worked with in the past who like recommended it to everybody, and I'm like, dude, I want to take this course, but it's
I don't know anyone who's done it.
They're like never in LA or like in Southern California, I should say. Right. Like there's like maybe
road
one.
Trip.
Yeah, I know. I'm like, come on, and it's never a convenient time.
Yeah.
It's always like, oh well, there's games. I'm in season.
Right. Yeah,
athletics needs
forever.
I know. Athletics needs to revolve around more about my educational interests.
You gonna sell that?
I'm gonna sell that. Athletics just gets in the way.
Yeah. How dare they?
How dare they?
So if you have any course recommendations, we will put that up on our Facebook group that we talked about before, facebook.com/group/AT Corner Podcast. If you're looking for CEUs, we do have some CEU eligible episodes, so make sure you check out. You can go to our website, or you can just scroll through the rest of our podcasts and look at the ones labeled CEU, thanks to Mass General Brigham. And I think, do you have any other like CEU courses that off the top of your head? I feel like,
oh yeah, DNS, the dynamic neuro.
Oh man, I haven't heard that in a long time.
I really want to take those courses. Again, it's just finding the time. Right. That would be so great for just rehab in general.
So many courses, so little time.
I know. And so much monies.
You know what? They do get expensive.
They get expensive.
But they're worth it.
They are so worth it. They're fun.
They also get you a big chunk of your if you do like a course, like sometimes it's like 14 CEUs.
Yeah, you get a big chunk of hours done.
Yeah.
For sure. Mm-hmm. And you just get better.
You just get better.
You just get better.
You just get paid in knowledge.
That's what the students always tell me. I remind them like, no, you're getting paid with experience and knowledge. You can't put a price on that.
I'm like looking at our books to see if there's anything that jogs my memory. I'm sure after we're done recording, I'm like, dang it, that course.
Oh man, that one?
Yeah, let us know what you guys, if there's any that you're like dying to share that you think we should take or that other athletic trainers should take, because we're always looking, and
for sure,
I'm sure other people are too.
Mm-hmm.
So if you guys are new, we do every other episode as education or stories. This one was a story episode where we bring in athletic trainers and experiences from across the world.
Yep.
Next week, we will be going back to our education episode where we talk about CEUs. I believe next week is a CEU.
It is a CEU episode.
Next week is a CEU, so look out for that. Happy reporting year. Again, code AT Corner for MedBridge for $150 off. And I think that's all our fine print. You got anything else?
Nope, that was perfect. Thank you for helping us showcase athletic training behind the tape. Bye.